So greetings, welcome back to the Impact, and today I'm super excited to be joined here with none other than Mr. Emmanuel, all the way from Uganda. Please kindly introduce yourself.
My name is Emmanuel Ssekyanzi and I'm from Uganda. So I major into anesthesia and critical care, and I'm the founder of Medref Health Bridge Solutions. So we currently develop digital healthcare innovations in maternal health and child health, and we are happy to contribute to the well-being of the country and the nation as a whole. Thank you for having me, Martin. And after days and months of preparations, now we are here to have this interview, and we hope today we shall discuss the progress of innovation and digital health at our continent. And I'm happy to meet someone from South Africa and the South, where you are making great impact when it comes to digital health.
I'm super excited, as you might have heard from Mr. Emmanuel. So let's stay tuned as we get to discuss digital health and what is digital health with the help of Mr. Emmanuel, who is already currently running within the industry. Okay, can you provide an overview of your digital medical business and the specific niche or a problem it addresses?
Okay, thank you. So what we are doing at Medref is we are developing digital solutions, and some of them you have heard. We have the digital referral system. We have YouGovAx, which is our groundbreaking technology, and it's into tracking the vaccinated and the unvaccinated children, and also identifying the areas that are at high risk of being unvaccinated. To call your attention and the attention of the world is Sub-Saharan Africa contributed almost 85% to the 5 million under 5 deaths that happened in the world. And it's also saddening that the under 5 deaths in Africa are 11 times more in Sub-Saharan Africa compared to New Zealand and other parts in Europe. So we need to wake up and identify these areas and make sure that we bring them to the policymakers and have them served in real time, and we stop the preventable deaths.
Okay. So what inspired you to venture into the digital health system, digital health care?
Okay, I think the world is now waking up to that, attaining the SDGs, if you have heard of them, and innovation is part of them. And also we know about the universal health care coverage. So in order to make sure that everyone receives care in an effective cost and everyone is connected, is why we came into digital health. And we are coming from a country that is separated by mountains and long distances, and we are coming from Africa, where you can have one referral hospital and it is serving almost 6-7 districts. So how do we reduce the burden without duplicating resources? And that's why we are investing into the digital health. We think it's going to be a big thing at the African continent in the coming years.
Okay, so could you share some key technological innovations or advancements that your business has implemented to enhance healthcare delivery?
Yes, so we have one that is interesting, is the digital referral system, and this one we brought it to make sure that there is confidence when referring a patient. So what we found out is when a patient is being referred from one level to another, in Africa, basically, if I use a case of Uganda, it's about the mercy of the doctor to call, the referring doctor to call another clinic to confirm whether there is an ICU. And this has brought scenarios where when a patient moves from one hospital to another, they find that maybe the ICU is not available. So in that confusion, we lose a patient. So how do we make sure that the patient data reaches the hospital first? How do we make sure that there is confidence that there is an ICU bed, that there is an ambulance, is making sure that the whole process is streamlined? And that's where we came out with an innovation we call the digital referral system. So the other one is the YouGovAx that we have talked about. So YouGovAx comes from the experience that we have seen, that when you talk about zero-dose children, those are the children that have never been vaccinated. And then we have the dropout rate. Now, when you look at the UNICEF reports, the dropout rate is high in sub-Saharan African regions. And why is this happening? It's because I take the first dose and I don't come back.
Okay.
So you are using paper, you don't know where I am.
Exactly.
Or if I was at this health center, then I get a better job in another region and I change to another region, you're not going to track me, you don't know where I am. And then I become prone to the preventable deaths. So how do we track them? How do we make sure that they receive the vaccinations timely? How do we educate them? How do we engage them using the mobile technology? That's when we came out with YugaVax, that we believe with the support from the donors and the governments and the stakeholders can make impact in terms of child health.
Okay.
Yes.
So ever since you started this movement, has any of the government or any of the officials that have actually reached out in order to support for you to be in a very perfect place to give help to much of the clinical centers?
Yeah, I think one of the things that we should acknowledge is the support that we have got, especially from the Ministry of Health in Uganda. So we really didn't expect that much of support. Okay. So we are a learning project, we are a learning company, and we learn every day when it comes to compliance, when it comes to funding, when it comes understanding the user needs. So we have got a lot of support from the Ministry of Health, from the user departments, there's a UNEPI, and from the technical working groups. So it's still alarming, and we expect to get more. We expect to go into the implementation phase with them, but it's better and interesting compared to what maybe how the outside world perceives the support from the African governments. But it's really interesting, and we hope we shall get there with them.
Yeah. That's particularly interesting, and it's super heartwarming when you see like Africans and some of the departments giving their hand in, because particularly as we know our continent, it's usually very skeptical and difficult for you to get support, especially when you start into something like this.
Yes, I think if you look at the research, there's a research that was made by Equivia, and one of the things they said that when you look at Europe, adopting these digital solutions was more about healthcare, more about the purchasing power and the per capita. But when they tried to replicate the same research in Africa, so they found out that this all was not correlating. And the major 2 points for embracing these digital technologies was about political will and the resource allocation. So the political will really means a lot when you are coming to start a business in Africa. But we hope that as a learning company, we shall know how to navigate through these political situations and the bureaucracies.
Exactly.
Yes.
All right. So given the highly regulated nature of the healthcare industry, how do you navigate and ensure compliance with the relevant regulations while still fostering innovation in your digital medical business?
Wow, that's a great question that we are also learning. So when it comes to compliance and regulation, so some of the African countries have not really come out with the digital regulations. And recently we know about the 2023 Indian Digital Health Law or the digital law. So some of them have not come out with the compliances. But where we have operated, for example, in Uganda, we have the 2019 Data Protection Act, there is a Data Protection Office, there is what they call HIRE, which is the Technical Working Group, and the DHI. So we are not perfect, you are not God. It's not that you're going to understand every compliance and every step, because as a startup, as an innovator, you don't have that amount of money to pay to a consultant to take you through. So from the mistakes you make, you have to be able to learn that I made a mistake, and the government will be there to regulate. So my concern would be that governments should now make maybe an office to support these innovators and make sure that they learn the compliances and they follow them with a reduced charge. Yeah, you know, when you're going to get one compliance consultant, you're going to pay almost something like $4,000 to $5,000 because they say when this project becomes national, you're going to get a lot of money. But how do we give it for free? And they have been supportive.
Exactly.
Another move that we have seen that is really happening, especially in Uganda, is the local data hosting. So these governments are calling up us, the innovators, to make sure that the data is locally hosted in the country, even though the cloud is coming. But also we also ask that let them partner with the cloud providers like Amazon to make sure that there are cloud servers in our country, and that could help scalability but also protection happen. Yeah.
I understand like every entrepreneur faces challenges and difficulties when it comes to, you know, starting such bigger projects. Because this one, we are not talking of a $2 project. We're talking of a very big project. And it needs a lot of hands at the same time, a lot of cooperation from different regions. So what are the major challenges have you faced along your way in trying to establish, to take the first step that you've already taken up to now?
Okay, thank you, Martin. I think this is something that I've really wanted to discuss with everyone, and I hope people in Zim and South Africa will like. I'm someone who is a winner and a dreamer, and if I was supposed to read the compliance of digital health in Africa, it would take me 10 years to start. So we start, we make mistakes, we get corrected by the governments and the compliance regulation officers, and they are so supportive to understand that we are young innovators. Then, apart from that, is building a team.
Exactly.
That's the biggest thing, because you need the funds and you don't have funding. So funding is scarce at the African continent.
Exactly.
It's not like you are in US, you have an idea and then you have pre-seed amount of $2 million funding. You're not going to get that. They're going to ask you for traction. So funding has been a challenge, but through that, we have been able to build a strong team. And this strong team has been there even though the funding is not available, but they follow the cause. So I came here to give you an example of what I call the hardships we have found when it comes to funding and the support. One is about the policies that we have in Africa. For example, if I'm going to get a trademark in India, so that one will be 500 rupees. And 500 rupees, that's 500 rupees is like 25K in Ugandan shilling. If I'm going to do the same in Uganda, I'll need 2,500 rupees. So I'm a startup, so that means a startup in India is going to be charged 500 rupees for its trademark. In Uganda, I'm going to be charged almost 5 times more.
5 times.
We are all startups. Then, if I'm going to register copyright and trademark together, it will take me almost 14,000 rupees without a consultant. So it will be 14,000. If I'm in India, it will take a total of maximum 4,500 rupees. So how are the policies supporting the innovation and the startup culture at the African continent? It's really hard, because the same amount that a 10-year or 10-branch company is paying, it's the same thing that a startup is going to pay. And that's why on this platform, I call upon all governments to look at the policies that have been put. And we don't want to judge Africa harshly that we have not done anything, because we have countries that have succeeded. For example, Rwanda is doing great. But we really want to see the policies that make the ground leveled for the startups and these big companies. So another thing was looking for a strategic partner. So when you look at some of the countries that we look at, the next countries to have big unicorns, that is China, India, USA, as they are top 3, USA, China, India. They have made sure that there are partnerships and correlations between these startups and the big companies. But if you are going to partner with the same big company in Uganda, the first question they will ask you is, okay, how much are we benefiting before they invest in anything? So it is not easy for us, and it has been a really, really hard transition for us to take transition from here to operate. So if I'm going to get an office space in India, you also know that will be 5,000 rupees. If I'm going to get the same, it will take me 20,000 rupees, which is close to $200 per month, or around 100. So the question is, how do we level the grounds for the young innovators to come in? So if you calculate all of it, it means someone needs almost a minimum of $4,000 to start in Uganda or any other country that you look as a sub-Saharan African country. But that means that same thing in India, someone needs $60 to start. And those are the people you're going to compete with at the global market.
Exactly.
So those challenges have been there, everyone faces them, and I don't want to cry over the challenges.
Yeah, exactly.
But we are going to be there as stakeholders in this startup ecosystem, and we hope the government will listen to our cries and make life balanced for us to innovate and create impact.
But of course, I have one more question that I'm supposed to ask. We cannot live without going through it. So what can we do better to improve innovation and startup ecosystem at the continent, and why is investment scarce at the continent?
See, after the pandemic, we had some good funding coming towards Africa. But this funding was not coming because maybe these people thought that we are adding value. You know, Africa has been in a state where someone funds because they feel Africa is left out.
Yeah. Exactly.
Yes, and it's interesting because I've been looking at Y Combinator and other funding VCs, and one of the things they put out is like, Africa is receiving almost 1% of the world's funding when it comes to VCs, so we need to go and help out. So one of the things that we need to discuss as Africa, that we don't want you people to come and invest because you have felt sorry that we are left out. We want them to invest because we can create value.
Exactly.
We can create value and create impact to the world. So that's the first thing, is let them not see funding as aid, but they should fund us because we are people who can create value for the next future. So the other reason why funding has been scarce is we have not been prepared very well. Exactly. So if you look, tell me any biggest VC you know when it comes to Africa. We are not prepared.
Yeah.
We are products of YouTube classes.
Yeah.
So you come to Africa where someone learns business or how to start a startup from Y Combinator, from a Silicon Valley kid who is going to get 500,000 USD in funding on a idea stage. So that's not going to happen in Africa. So how do we re-educate ourselves to understand what are the problems? A dating app could be a solution provider in India or in the West. But then we have potholes in Uganda, so dating is not a problem. We can find good wives without the application.
Yeah.
So how do we define, how do we re-educate ourselves and understand the problem statements that are really, really making sense in Africa? Then that one will help us attract more investors because we are solving problems by Africans for Africa. Now, the biggest question is, what can we do? So what can we do comes from on ground. How do we build the capacity? Because our education systems are not building the capacity of the people towards innovation.
Yeah, exactly.
So that one comes from the education system. How do we redefine it? Then, as I said, in Africa, there are 2 points: the political will and the resource allocation. So if we locate our resources effectively, innovation is going to be high. And then, is the political will? Do we have the politicians ready to create the platform for the youth to come and innovate? If the political will is not there, if the government is not willing to do that, then even if we have private funders who want to invest, without the political will, nothing can be done. So let us make the strategies to make sure that everything is strategized, is streamlined, to make that the African youth can really contribute to the next future. And this should not be about AI.
Exactly.
I've looked at OpenAI, I've looked at the AI that is coming. But the question I ask all innovators in Africa is, it's not about regulating AI. It's not about using AI to create a website. The question is, can AI help us increase accessibility to food, to free water? Can AI help us diagnose dangerous diseases? Those are the questions we have to ask AI when it comes. So for me, I'm not threatened by they're saying it's going to reduce employment and what. I want to ask AI a question. Are you coming to make sure that I can identify someone who is at risk of an accident? Can you make access to market easier? Then if you can answer those questions, then we are able to adopt, and we are really calling out to that. And we hope, I know in the coming years, investment is going to open more at the African continent. And we hope that the companies that do receive that investment use it to build. And when they build now, we want companies that when they start, for example, we have big companies at the African continent. We have Dangote. So what we ask Dangote is to build an infrastructure that could help the next innovators. What do I mean? If I was going to start Yugavax, and I'm going to build my own servers, that one would take me 2 years maybe, because I don't have the resources. But because we have cloud-based servers right now, so that means I can build today my simple prototype, and in next 2 hours I've hosted it on cloud. So how do we make sure that the big players right now we have in Africa, Dangote, ModG, and other people, how do they come out to build an infrastructure that other young innovators now don't start from zero? They have something to start on and build on. So those could be some of the simple things. Build the infrastructure, streamline the process, and make sure that you reduce some costs, like the company incorporation. So if I'm in company incorporation, consultation fees, the trademarks, copyrights, licenses, trading license, operation license, can we do that? Can we create open co-working spaces? So that's what we think, and I know that Africa is going there. I have a strong belief that we are going to do it, because we are into a generation that is believing in change. And we don't need to take any aid or to take sympathy from anyone. We have to create value, and it starts with us, and we shall create the value.
Yeah, for sure. In the description, you'll be able to get all the details and how you can get in touch with him if you want to have some personal questions. I'm sure you'll be open to that.
Yes, I'm always open to engage young innovators. And I hope I've met some. I've seen some make associations. I've seen Tanzanian associations in India. I've seen Ugandans. I've not heard about South Africa and Zimbabwe. But I hope these organizations bring value, and they don't remain to be WhatsApp groups. So we can interact and see how we take innovation together.
So guys, thank you so much. This is The Impact. Welcome back to The Impact. Stay blessed.
Come.
Mr. Emmanuel.
See you.
Thank you so much.
Thank you for having me, and we hope to be here soon.
I greatly appreciate it. I'm sure this is going to help some people and a lot of government administration to open their eyes, so that as you take off, they can also jump in the same plane. So you don't need to be left out of this new world of AI. For sure, it can be a threat, but it can also change your life.
Yes.
As long as if it can deliver what we want at our doorstep.